we are involved in a study that is really just beginning. In the fall, we really just started bringing some newer subjects in, and it's a study where we're trying to examine the effects of this very widely prescribed medication. They're cholesterol-lowering drugs in a class called statins, and we are trying to examine the consequences to skeletal muscle in terms of integrity or structure and function when people are taking these particular kinds of medications. We're examining anything from muscle strength to muscle fatigue, muscle oxidative capacity. We're looking at muscle metabolites, and we're trying to get a better feel for what's actually going on with some of these parameters of muscle structure and function. And we do this with some different exercises as well as magnetic resonance spectroscopy and imaging. So we're trying to understand if these very widely prescribed class of medications, if they're having an effect on muscle function. And so do they affect your ability, for example, to walk around every day? Do you get a little bit more sore when you participate in exercise? Does your strength level actually go down or deteriorate a little bit when you're using these medications? And in particular, the other thing that we're hoping to accomplish is to understand a little bit more about people who do develop some muscle-related problems, and if we have a tool that can identify if people are developing some problems. The study will run about 2 years. We follow people anywhere from about 2 months to 6 months, just depending on if they're taking a high dose of statins or a low dose of statins. Our preliminary findings from a couple of years ago were that one of the metabolites in the muscle was elevated in people that were using statins compared to age-matched people that were not using statins. And it was a marker that's consistent with elevated cell membrane turnover, which generally doesn't indicate a good thing. And so we're trying to confirm those results by studying people prospectively. This will answer a lot of questions that we have, a lot of basic questions, because we'll make a real rigorous attempt to quantify things as simple as strength, as simple as muscle fatigue. And then in the future, eventually what we would like to do is to, depending on what the findings show, we'd like to follow up to see if there's a particular type that people are tolerating more than others, why they tolerate some types more than others, and if just simple strategies, for example, taking the medication every other day or having the dose, what kind of effects does that have, or adding some kind of supplement that might ward off some of these skeletal muscle related problems. One arm of the study in particular that we're very interested in examining are people that are prescribed any dose, any type of statin by their primary care physician. And so we're looking at a wide range of medication dosage as well as type, and certainly a large range of even body size. And then we have an arm where we're going to be a little bit more controlled and study the effects of high dose statin use.